So I was saying it's very weird to record because nobody's here. Now I have two person here with me. So welcome to this webinar on intuitive eating and type 1 diabetes. So as you can hear, English is not my first language. So if you have any question regarding some words I use, you can ask them in the discussion. And if you have any question, then in the Q&R. So, or maybe just in the Q&R. I don't know, Sarah, if you prefer in the Q&R also for French and English translation. Okay, and anyway, so if you're not sure what word I'm saying, just ask in the Q&R or in the chat, and me or Sarah are gonna answer to this question. So who am I? First of all, I'm a registered dietitian, and I'm also a type 1 diabetes myself. I work in a private practice as a dietitian. So the summary of this presentation. So first of all, we're going to see what is intuitive eating, why consider it in the context of type 1 diabetes, and is it possible to eat intuitively without affecting blood sugar management? Of course, I would say yes to this question. So what is intuitive eating? Oops. So intuitive eating was not made up for people with type 1 diabetes at all. It was an alternative to the dietary restriction, the weight loss restriction that has a lot of harmful effect on everybody and doesn't seem to work very well. So a lot of people are kind of stuck into cycling dieting all the time, are not very happy, and are not even leaner with the diet. So it was meant to be an alternative to all those diets. It is not a weight loss method, and it is not at all a blood sugar management method. It is a way to learn to recognize our hunger, satiety signal, and to reconnect with our kind of our emotion regarding eating. So there are 10 basic principles that we're going to see later. They are here now, but we're going to talk about them later. So a lot of people would think that eating intuitively means eating whatever you want, however you want. So a lot of people would say intuitive eating is about eating pizza or chips or cookie or chocolate, but it's not at all what it means to be eating intuitively. You could be eating a lot of chip or cookie, but it's not what it means. It's not that you're just gonna eat some dessert or fast food, not at all. So it's a way to, when you eat, you will be based on your hunger signal, and you will be based also on your desire, your emotion, and also on your knowledge. So for us, type 1 diabetic, for sure, we have a lot of knowledge on food. So we cannot make an abstraction of those knowledge. So we will make some choices based on all of those things and a lot more probably. So why considering intuitive eating in the context of type 1? So for the diet restriction, for the people who want to lose weight, over the long term, we know that food restriction is one of the strongest predictor of weight gain. So on the contrary of what they're trying to achieve, it's a strong predictor of weight gain. And it's a strong predictor of eating disorder too. So we can ask ourselves, so perhaps we should ask ourselves, about its impact on blood sugar. So could it be that it also has a negative impact on blood sugar management? So on the contrary, you would think having a lot of restriction would help us manage the blood sugar, but maybe it's not that positive to have all those kind of restriction. So that is the question. So for us, type 1 diabetic, we have a lot of chances, I don't know how to say this, but we have a lot of chances to have an eating disorder or disordered eating. I'm sorry if I don't say this word well, it's very hard, disordered eating. So eating disorder, you probably know a lot about that. You heard about anorexia, for example, or bulimia, which are very well-known eating disorders. So you can have a diagnosis based on criteria for those eating disorder. You also have hyperphagia, which is it's binge eating disorder, which is kind of the bulimia, but without the vomiting or excess exercise or laxative. So it's kind of the bulimia, but without I don't know what's this word, it's purge, we say in French. And you also have a specific eating disorder. If someone knows what the word purge in English, just say it in the chat. There's also a specific eating disorder for type 1 diabetic. So it's bulimia, but with omission of insulin. So you will not take your insulin shot, or you will give just a little bit of insulin so that you can lose weight. And for type 1 diabetic people, one person in 14 will have an eating disorder. So are living right now with a eating disorder or had an eating disorder. They are 2.5 times more likely for teens with type 1 diabetes to have an eating disorder. But there's also all the disordered eating, which are not, don't have the criteria, the medical criteria for an eating disorder. So there is up to 2 in 5 women between the age of 15 and 30 who has a disordered eating pattern. So there's 20% more chances for type 1 women to have disordered eating, and it's almost half of the women who has a disordered eating pattern with type 1. So the effect of eating disorder or disordered eating are possibly immediate and acute. So of course the severe hypoglycemia or DKA, can I say this in English? Astrocytose. I don't know if I can say this in English. So it could be very acute and immediate, but you can also have long-term consequences. As you know, our eyes, kidney, nerve, we can have consequences on the long term, but also you can have a lot of like mental or social consequences. So for example, if you have a teen who was stuck with an eating disorder or a disordered eating, who did not go to school as they wish they would, so they did not get the diploma they wanted, the job they wanted, they did not create a circle of friends because they were very isolated with the eating disorder. So this can have a lot of consequences long-term also. The reality of living with type 1 diabetes, I will not teach you something today. You probably know everything about that, but sometimes the medical team or our family or people around us are very oriented on outcome. So the blood glucose result, the HbA1c, the weight change. So if you lose or gain weight, the food you consume. So very oriented on fact instead of looking at you as a whole. And it can bring us a lot of sense of shame, a feeling of failure, lowered self-esteem. And we can also have all those feelings, but internalized feeling like this. So ourselves, we can judge ourselves on our blood glucose result, HbA1c. So we can think about us as good or bad diabetic with those glasses of very result in the blood or result on of weight. So we can judge ourselves like other people can judge us. So we can develop a feeling of inferiority also if we don't get the result like the clinician would like us to get, or if we don't get the same result as another type 1 beside us. So we can feel also that we have to justify to clinician or family member everything we eat, everything we do, what kind of a job we have. If you went out last night, if you drank a beer or a glass of wine. So you can feel that you always have to justify yourself. And a lot of people are looking at you and what you eat and judging it because they want to take good care of you. But the impact of this is feeling like we're living in a Big Brother book. So what are the risk factors for disordered eating or eating disorder? So you have age. So a lot of teens will develop eating disorder, gender, more women than men. BMI, which is your weight versus your height. I don't know how to say it. You don't have a lot of power over this. You don't have power over your age. You don't have a lot of power over your gender too. Your personal characteristics. So if you were the kind of person who has a portrait of someone who could have an eating disorder, and then you develop type 1 diabetes. Maybe it was the little go-to this eating disorder pattern. The family support you have will also have an impact. The body image you have of yourself, and of course the nutritional approach. So when you first were diagnosed with type 1, or what nutritional approach you use right now. So this is the point that we're going to discuss now. So the nutritional approach, as imposed by your team or imposed by yourself sometimes, can have a lot of impact on the well-being. So for example, meal planning can be very rigid, especially for people who have been diagnosed way before. So I was diagnosed 25 years ago. At that time, we didn't have a good insulin. We had the white insulin. So we had a very strict planning. You have to eat at noon, you cannot wait. You have to eat at this when you wake up in the morning. You have to wake up in the morning to eat. So it was very rigid. A precise measurement of food and portion consumed. So of course, we will still have to look at the carbs we eat, but is it very important to measure or weight our food very, very precisely? So we're going to see this later. We have restriction related to what we're planning to do, or we have to eat sometimes, even if we're not hungry, because of hypoglycemia or prevention of hypoglycemia. Just before, I was giving the same webinar, but in French, which was way better in French. And I had to not treat, but to prevent an hypoglycemia. So this is maple syrup I had beside me. So I had to take a sip of maple syrup while I was doing the presentation, because I saw my blood sugar going to 4.2, 4.1. Now I'm good, I'm 6.0. So I had to eat even if I'm not hungry. So it's not my body telling me to eat, yes, a little bit, but because of diabetes. There can be a sense of shame related to overcorrection of hypoglycemia. So a lot of us has been, what is this word? Boy, we'll say it in another way. The medical team can be very, make a lot of comment about overcorrection of hypoglycemia. So we can feel a sense of shame regarding this, because after an hypoglycemia, we can have an hyperglycemia, or we can eat a lot of calories. So if we have a focus on calories and weight, also we can feel a sense of shame related to overcorrection of hypoglycemia. Our diet is scrutinized by the team and the family. So even if it's not about carbs, a lot of people will have comment about what we eat anyway, carbs or no carbs. So a lot of people looking at us, what we do all the time. It's not everybody that has to live like in the public eyes with what they eat. So this is very related to being a patient with diabetes, all types. There's excessive concern about food. No, for type 1 people, we can have excessive concern about food for glycemia, but like the rest of the people who are not diabetic, we can have a lot of concern about food for the weight management. So I think it's 2/3 of the people who have a concern about food for weight management. So we have like a double concern. Potential adverse effect of current approach. So at the food level, we can have voluntary carbs restriction or voluntary calorie restriction that we impose on ourselves. And at the cognitive level, so we rely on external cues to eat. So we eat according to the plan, according to the doctor, according to the nurse, according to the dietitian, according to the blood sugar. Like I said, I was very near hypoglycemia. I had to eat anyway. So it's all external cues that will tell us to eat or not to eat or what to eat. So this weakening our internal signals of hunger, satiety, and fullness. It's not lost, but it can be very weak. So if it's been like 15 years, you just eat like according to the plan. Do you still know when you feel hungry or when you're full, or can you feel this sense of fullness or satiety, maybe it's kind of lost, but it's not dead. That's the word I should use. It's not dead, but it's kind of lost. There's a sense of deprivation for sure, and a sense of failure that we talk about. So this can bring us into a vicious circle of restriction, which I will show you. So at first you have the desire to control your diet for blood sugar or weight management or expectation of your medical team. Then you go into restriction. And then probably for most people being in restriction, you will have a lot of food thought. So you will think about food, you will have food rage. Then you will feel some shame and guilt, sense of failure because you're supposed to be restricted and now you're thinking about food, and then you go into loss of control and you will eat a lot of that food that you were trying to restrict at the beginning. Again, shame, guilt, failure, all over yourself. You will have as a consequences glycemic imbalance and weight regain. And then again, a lot of shame and guilt, sense of failure, lower self-esteem, etc. And then you will probably think, I need to be more strict. And then you're stuck in this vicious circle. Of course, consequences of a bad relation with food for us, type 1, compromised glycemic balance. So as the contrary, we would think restriction help the glycemic balance, but probably for most people would be worse because of all those vicious circle I talk about. And then you would have an increased risk of acute or chronic complication, like I told you, and mental well-being greatly affect. Like I told you, even social well-being can be affected long-term because of something you went through when you were maybe a young adult. If you need to seek help, medical help for this, I suggest you find someone with both expertise in type 1 and eating disorder. And also, if you still have this idea that you need to lose weight, then you need to have someone who understands very well eating disorder, type 1, and weight management. Ideally, I know it's not so easy to find someone, but you would need someone at least who understands eating pattern and type 1. Is it possible to eat intuitively without affecting blood glucose management? Yes, very possible. So, like I told you before, the choices you made when you eat are like oriented with when you eat intuitively. You are oriented by your hunger signal, your emotion, desire, and your knowledge. For us, type 1, I would say knowledge is very important. So sometimes we will focus a lot on hunger signal or desire when we work with intuitive eating with people who are not type 1. But with type 1, of course, you still need to check your blood sugar, calculate your carbs or your insulin needs. So of course, you always need to have knowledge at the same time than your emotion and desire. So I call this the informed intuitive eater, which is kind of what is already proposed with intuitive eating, but the focus is so not on disease in intuitive eating that I want to say that it's very informed intuitive eater, when it's for people with chronic disease like us. So how can you eat intuitively with type 1? So first of all, if you have an eating disorder, you need to address the eating disorder, or else it will be impossible to achieve intuitive eating. So I wish you can heal from your eating disorder, but at least manage it very well. I don't know how to say this. It's not manage, but live with it very well and calm it down a lot. But a lot of people can heal also. So don't be discouraged. You can heal from an eating disorder for sure. So for people with eating disorder, sometimes we will work a lot with no restriction at all. So we will put the diet on the side and we will focus only on insulin, and we don't talk about food because we need to reconnect with emotion, desire, hunger, satiety, fullness. So we really need to work this, we really need to work on this path if we want to manage blood sugar with food strategy later. So like I told before, it's sometimes, I really don't know this word, but it's a passage you have to go through, even if it's hard, because you will have to let go of all the perfection, the restriction, the everything you think is really good for you. So it's like having cancer. If you have to go through chemo, it's not like having cancer. That's not what I'm trying to say, but sorry for my English. I try to compare something. If you have cancer, you have to go through chemo. Chemo is not fun. It's very hard. You will suffer, but you have to go through chemo if you want to get out of cancer. So I would say it's the same thing. If you want to get out of the eating disorder, you need to go through the healing process, which is hard and difficult. At the same time, because we're type 1, we're going to need to manage insulin very well to lower the effect of like eating a little bit bizarre, if I can say, because when you need to reconnect with your emotion, when you're eating, you need not to judge and just to go with the flow. So you will need a lot of education on insulin management. When you're good with your eating disorder, you can use the nutritional strategy as a complement. So you will use also food, but it would not be your first choice of restriction. You will focus more on management of insulin, and then as a complement, you can add some protein or fiber to digest slowly the carbs you eat, for example. You will need also to have in your head the very real concept of harm reduction. So what is worse between having a lot of restriction, which I think give me good control of my glycemia, but in the end I have to see that sometimes it's worse when I have all those restrictions. So maybe I will choose to eat more carbs, eat whatever I want, have a less good glycemia for now, but overall my glycemia will be better when I don't have this black or white thought about food. So you really need to like get out of yourself, look at you, don't judge, and just look at what happened to you in the past years. Is it really that good for you to restrict, or is it an idea that you think it's better but it's not? Again, surround yourself with professionals who specialize with eating disorder and type 1. So now we will see the 10 principle. Okay, I need to look at my paper now. So reject the diet mentality. So when I say reject the diet mentality, and I'm thinking about type 1, I'm also rejecting the perfect eater, the perfect type 1 mentality. So it's not to say that glycemia is not important. This is not at all what I'm saying. Glycemia is important. Control of the glycemia is important. It's for your health. Everything is important here. But like I said before, is it worse when you restrict your food thinking it would be better, but in the end it's worse? So you really need to be able to see this. The focus needs to shift from food restriction to insulin management for you to feel free with food, and probably you will have some imbalance in the glycemia for a while. Yeah, ideally you will stop comparing yourself to other type 1 or other people. It's easy to say, not so easy to live, but you need to stop to compare yourself. Everybody has different needs. Everybody has different past, and you also need to lower the pressure of performance in front of your healthcare team. And I strongly suggest, if you go through this path of healing your relation with food, you tell them that maybe it's going to be a little bit less perfect for a while, but you have faith that it's going to be better at the end. So you have to go through this. And so when you tell them, at least you don't feel so much judgment if it happens. that you don't have the perfect control as you're used to have. The next one is honor your hunger, and I will talk about this one at the same time. Then the sixth one, feel your fullness. So honor your hunger. First thing, you need to know what is your real hunger. So there's many kind of hunger. You can be like physiological hunger. So for sure it hurts, your stomach is like all twist and you need to eat, with this very physiological hunger. But you can have also emotional hunger or just appetite hunger. So let's imagine you're at the restaurant, you're full, everybody's full, your pants are very tight, you cannot eat anymore, and then the waitress comes with like the plate of dessert, and all of a sudden you're still hungry. It's because we have a second stomach. I said, like, for dessert there's always room in our stomach. So so all of those hunger are not to judge them. It's not that your appetite hunger or emotional hunger is bad and your physiological hunger is good. It's just to like acknowledge them and then decide what you want to do with your hunger. And of course, for you have some medication or something that can alternate your hunger. For example, when you have a hypoglycemia, you will feel a lot of hunger, which is not really physiological, a little bit because of the blood sugar, but it's not that you really need to eat for your stomach or your energy needs. It's really for your blood sugar. So you need to just acknowledge all those kind of hunger, like I said. Next one, the three next one, make peace with food, challenge the food policy, and discover the satisfaction factor. So first of all, you need to reconnect with fun in your plate. So fun food that makes you feel good. So I think we call this in English gentle nutrition, something that makes you feel good. So your health is also related to how you feel in your life. So of course, someone who feels good and happy has a lot more chances to have a better health than someone who is not happy. First of all, someone who is happy will take better care of himself than someone who is not happy. But happiness is good for health too. And the happiness in your food also is good for your health. So imagine you eat 3 to 6 times a day, maybe 10 times a day if you get a lot of little snack. And people have access to this happiness or pleasure, those 3 to 10 times a day, and you cannot have access because you're type 1, for sure you're in a deficit of happiness, for sure, because it's something that happens every day, several times a day. And if it can make you happy, why not? Because it's not because you're type 1 that you cannot have happiness in your plate. So you need to acknowledge this, and you need to acknowledge that satisfaction in your plate will also be better for your health. So for example, if you want to eat chips, you have this in your head, you're thinking about chips. In my case would probably be salt and vinegar chips. I'm thinking about it, then I don't want to eat it because it's bad for my health, and I'm eating celery, and after that I'm eating an apple, and I'm still not satisfied with this, and I'm trying to eat, I don't know, almonds, and finally I will eat my chips anyway. So maybe if I would have eaten my chips at the beginning, I would not have all of those food that did not make the job. So it would be better for me if I could see the future. If I know that anyway I'm going to eat the chips, I better be eating it right now. Yes, and something else that I want to say, it's not because you're type 1 that emotion eating is bad and pleasure with food is bad for you. You can have pleasure with food, you can have emotion eating also. So we need to relearn, like erase and relearn how to classify food. So when you classify food as bad or good, it's not what I suggest at all. So we learn this way of saying this is good, this is free food, no carbs, this is bad food, very high glycemic index. So it's just to relearn this, to say this food has this kind of impact on my glycemia. This other food has another kind of impact. It's not that one is better than the other one. I want high index glycemic index when I'm in hypoglycemia, or I really enjoy although maple syrup product are one of the one I preferred. So it's not all bad. It's just that it has an impact on my blood sugar. So you need to relearn how to classify food in a system that is not black versus white or bad versus good. Then you need again to learn to use insulin instead of the food. And one of the exercises I can suggest you do is a list of all the food you restricted yourself from eating, and you can classify them from the one that is you're scared to eat and the one that is less scared to eat. So, and when you reintroduce those food, you always start by the one you are less scared. So I don't know, let's say popcorn doesn't scare you as much as chips. You will start with popcorn. So this way you can learn in peace and not the feeling of danger of eating something that in your mind is so bad. So there's nothing good or bad except poison. That's it. Or if you have allergic food, for sure you don't eat this. And then you can have also a list of all the thoughts you have about food, which, for example, we say aspartame. I don't know if it's the same word in English, aspartame. Aspartame is bad for your health. I don't know if it's true or false, but I can write this down, and then I will do research with the eye of a scientist. So I will be very judgmental of what I will read. I can ask other type 1. I can ask my doctor, dietitian, nurse, and then I can relearn maybe that some of the things I was thinking are not so true. Maybe they're partially true. Maybe they're not true at all. So another one, the 7th one, is cope with your emotion with kindness. So to cope with your emotion, you can see it as a toolbox that you have. So everybody has different tool in the box. So for example, oh mon Dieu, le mot marteau. Quelqu'un, sortez-moi le mot marteau. Il est sorti. What is a... You have it, marteau? Sarah, Google it, il est parti de ma tête. Hammer, merci. Il voulait pas revenir. Okay, so for example, if you need a hammer, but you only have a screwdriver to hit the nail, then you can do the job all right. Let's say you can hit a nail with like the back of your screwdriver, which will be okay if you only have one nail. But if you have to build a house and you only have a screwdriver and no hammer, and then you need to hit all those nails with the screwdriver, then maybe you're gonna break the screwdriver, and maybe your house is not gonna be solid when you build it. So I can compare this with emotion, like eating when you feel distress or stress. It can be okay. It can be a good technique. But if that's the only tool you have to manage stress or negative emotion or even good emotion, then maybe it's not so appropriate and you need to find other tool or to develop other tool or to buy other tool. So you need to relearn how to cope with your emotions. So again, you need to be a detective of yourself, get out of yourself, look at you, don't judge, just learn. Okay, when I have this kind of stress, it makes me eat more. Maybe that's not the best response. Can I try something else? And I can eat. It's okay. It's not always bad to eat your emotion, but is it the best way now? Or maybe today maybe today I feel stressed. I want to eat ice cream, but tomorrow I feel stressed and I'm going for a walk. So I just need to learn to watch myself and don't judge and try to find other tools that I can use to manage emotion. Next one, respect your body. Respect your body was very made for the people who are trying to lose weight. This principle is really about learn what your body can do and not only what it looks like. So a body can do a lot of things for sure. Makes you get up this morning and work and hug your kids or kiss your wives or husband. So your body can do a lot of things besides being looking a certain way. So for diabetes, diabetic type 1, I would say also to try to look at your body for what it can do, but with also the sense of, for sure, we cannot produce insulin. So I don't think there's nothing that can change this for now. So you cannot produce insulin, but your body can do a lot of other things. And also probably for most of us, there's also some positive thing about diabetes. I'm not saying that the positive are better than the negative. Negative is probably worse, but also you probably have some better empathy. You're probably better in maths than most of the people you know. You have a lot of knowledge about food, a lot of knowledge about health. You're very like you live in the conscious of your health for later. You don't have to wait till the end before you say, I should have done this or that. You're already in a position to look at yourself and make some choices for yourself that will give you a better outcome in the future. As for myself, for sure, if you tell me tomorrow I stop having diabetes, I would say go for it. I'm all in. But it brought me a lot of positive thing. Also, I work as a dietitian with the people who are diabetic, but also I work in the healthcare management. No, not management. Quality of care. Like to have better quality of care. So I work in this field with my patient hat. So it's really my experience that brought me there. So I have a lot of things that I'm grateful for, even though I'm diabetic. Movement feel the difference. This one is kind of difficult because physical activity is very good for everyone, even type 1. There's some disadvantage when we have type 1 diabetes with the physical activities, but there's a lot of advantage too. So it's better to have some in your life than none. This is for sure, but it also comes with a lot of challenge. So when in intuitive eating, they say, feel the difference, they're talking about don't keep your focus on your weight, on your look, but on how it makes you feel to move. For sure, it makes us feel good, but also if 10 minutes later you're in hypoglycemia, good and bad at the same time. So I would say you need to focus on the good and on the processes of learning. So every time you do the same physical activity, you can learn a better way to manage insulin or food to help you achieve what you want to achieve with physical activity. But I cannot tell you that you're not going to feel some challenge doing physical activities. And again, there's a webinar. I don't know if it's in English too, but there's a webinar on physical activity with the Better Type 1 team, which is very good. It's a very good start when you want to start to move, even though you're diabetic. So give yourself the chance to have this tool in your box, the movement, the physical activities. Then the last one is honor your health, gentle nutrition. So this one is very important for people with disease like ours. So again, it's not to say that health or glycemic control is not that important. It's important, and to me, it's even very important, but I don't have to choose between my well-being, my mental health, and my glycemia, or my relation with food. So it's not exclusive. You can have all of this at the same time. So you just need to learn different way, maybe of thinking about diabetes, or different have different tools. Those one are not for coping with emotion, but different tools like what kind of insulin you use, how can you manage insulin differently, so that you can have access to gentle nutrition for yourself. And you have to find what, I don't know if it's a good word in English, but what makes sense. Yes, it's a good word. Makes sense for you. So what makes sense for me right now, I'm a 26-week pregnant. So what makes sense for me right now is not really about gentle nutrition. It's about glycemic control. But I'll tell you, like, as soon as the baby's here, I'm going to eat sushi. Because of raw fish I cannot eat right now, but also because the rice in the sushi are very hard to manage sometimes. And with the pregnancy, I don't want to take that chances. I think I only ate one time the sushi. So it makes sense for me right now to not really think about what is better in my mouth, but what is better for my kid. But at some other times, I will be less rigid with myself, less strict, and it's also really good. So what makes sense for me now can change with the time. So I just need to always be attentive to my needs right now as they are. It's near the end. I see that you're still here. The 3% are still here. It's good. So limiting factor to intuitive eating. For sure, what the kind of approach we learned when we first were diagnosed with type 1 can like let some laisser des traces, comment on dit ça? You would still have it in your mind for a lot of, like for several years probably. So we're a bit, we have a bit of trauma related to nutritional approach, sometimes the disease itself and the nutritional approach. The presence of an eating disorder is a limiting factor. You really need to acknowledge the eating disorder in order to be able to eat intuitively. The desire to lose weight also, same things, will take a lot of room in your thought. So it's more difficult. So we need to address also this. Access to therapeutic education. So like the management of insulin, the very well management of insulin, when you want to eat whatever you want, whenever you want, you need to be able to manage your insulin. So sometimes it's the education is not offered by your healthcare team. Maybe you can Google or use a patient group, but you have to be very critic when you read things if you're not sure they are good. Access to best technologies. So for sure, it's way easier to eat intuitively and keeping a good glycemic control if you have a CGM. For sure, if you have a pump, better than injection, but it's not a must. It's just better. Financial aspects. So technology is very dispendieux. Le mot est encore parti. You need money to have technology. So it's not everybody who has access to technology, for sure. Even to eat whatever you want, whenever you want. If expensive, thank you, sir. Like even to eat whatever you want, whenever you want, can be expensive. If what you want is sushi, for example, it's more expensive than, I don't know, pasta. The presence of intolerance, allergies, or other health issue is also a limiting factor. If you have a non-supportive care team or family, same thing. All the myths and beliefs you have about food, but this you can heal from those beliefs. So in conclusion, I would say that becoming intuitive eater is not about living in that denial of the disease or the needs to have a good management of glycemia. It's more to stop living in the denial of your own humanity and your physical or emotional needs under the pretext that it's normal because you're type 1. So you don't have to choose between a good control and a good life. You can have both with all those new insulin that we have that we had for a while now. So you can have both. And it's time, I think, to reclaim the right to be autonomous, free, and happy right now with yourself, your disease, and in your plate also. So that's it. Thank you. I will see if there's any question. I don't see any question. Do you have any question? I think we still have time. Oh, papier, 46. No question. Thank you, everybody, for being here. Oh, one question. No, thank you so much. Thank you for doing this in English. Thank you for listening to my very bad English. So if you have any question later, you can always write to the Better Type 1 team, and I will answer later also. Thank you, everybody. Have a nice day.